Suppose you are faced with a question about an elderly patient with progressive memory loss. The patient's family reports that they've become increasingly forgetful over the past few years, struggling with daily tasks and occasionally getting lost in familiar places. Sound familiar? This is the classic presentation of Alzheimer's disease. Now, let's break down the key elements you need to spot in the question stem. Gradual onset of symptoms, typically over years, progressive memory impairment, especially for recent events, difficulties with executive functions like planning and problem solving, language problems such as word finding difficulties, disorientation to time and place, changes in mood and behavior. But here's the catch, several conditions can mimic Alzheimer's. How do you differentiate? Let's look at some tips. For vascular dementia, look for a stepwise decline and history of cardiovascular risk factors. In Lewy body dementia, watch for visual hallucinations and Parkinsonian features. Frontotemporal dementia typically presents with personality changes and disinhibition earlier than memory problems. Understanding the pathogenesis is crucial. Alzheimer's is characterized by accumulation of beta amyloid plaques, neurofibrillary tangles composed of hyperphosphorylated tau protein, neuronal loss and brain atrophy. These changes lead to a decrease in acetylcholine, a key neurotransmitter for memory and cognition. For first-line investigations, remember the three key steps: detailed history and physical examination, cognitive assessment using standardized tests like the mini mental state examination, neuroimaging, typically MRI, to rule out other causes and assess brain atrophy. In terms of treatment, your go-to options are acetylcholinesterase inhibitors like danpezil for mild to moderate Alzheimer's, memantine for moderate to severe cases, management of comorbidities and behavioral symptoms. Remember, while there's no cure yet, early diagnosis and treatment can significantly improve quality of life and slow disease progression. To wrap up, let's revisit the common presentation. Alzheimer's typically begins with subtle memory lapses and progresses to more severe cognitive decline, affecting daily functioning. Patients may struggle with complex tasks, show poor judgment, and experience mood changes. As the disease advances, they may have difficulty recognizing loved ones and require full-time care. That's all for our Alzheimer's disease review. We hope this helps you ace those tricky exam questions. Stay tuned for more medical insights in our next video.